Hello, everyone. It is Monday, November 9th. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. I'm here to give you the update on the COVID-19 pandemic as it affects Mobile County. So as we often do, I'll start just with a little bit of worldwide context. So globally, more than 50 million cases of COVID-19, with over 1.2 million deaths. In the U.S., over 10 million cases with nearly 238,000 deaths. And in Alabama today, reporting on 204,857 cases with 3,084 deaths. So in our daily report today, we're reporting on 17,913 COVID cases in Mobile County. Yesterday, 25 cases were added, 59 on Saturday and 63 on Friday. Again, remember, because things close down on the weekend, we usually see a very low number in the beginning of the week, and then it sort of builds as we move on. So on average, we're seeing about 55 cases added on average every day. So 331 people have died with COVID, and in Mobile hospitals, we're cumulatively counting 2,365 people hospitalized in Mobile County hospitals with COVID-19. 6 were added just yesterday. And then the daily number of people in the hospital still sits in the low 80s. It was 82 yesterday. So our weekly expanded report also came out today. Not a whole lot of surprises there with regard to trends, but there are some new charts in the weekly report that I want to bring your attention to. Remember, since we began talking about COVID back in March, Mobile County Health Department, in line with the Alabama Department of Public Health, in line with the Centers for Disease Control, was reporting on cases of COVID-19 by report date. So that is very unlike any other infectious disease that we conduct surveillance for, where we generally conduct an investigation first and then report out based on something that makes more sense having to do with the biology of the illness, illness onset date, specimen collection date for people who are asymptomatic, that sort of thing. So this week in Figure 2, we have Figure 2A and Figure 2B. So in Figure 2A, we're showing the number of cases reported weekly by report week. And this is where you'll see that really heavy influence by that backlog of data that was processed on October 22nd. But we've plotted that by infectious week to try to smooth out the effect of aberrations in reporting, because that report date is influenced by all kinds of things that have nothing to do with the biology of COVID-19. So with infectious date, or the infectious week, or the infectious month, ADPH is estimating the date that a person was most likely infectious, and that's by the earliest date of illness onset or specimen collection date for people who are asymptomatic. And if you're missing illness onset date or specimen collection date, then we go by the report to public health, whichever of those dates is earliest. So in Figure 2B, you can see where we've been able to smooth the trend of cases from that very large dump on 10/22, been able to smooth it out back to June by plotting the cases by illness onset date or specimen collection date. So we'll include both of those in our report this week, and then probably going forward just the infectious date. So also by month, on Figure 3 and Figure 3A, you can see again for October, 3,693 cases reported in October, heavily influenced by around 2,500 that were reported just on October 22nd. But if we smooth that by looking at the specimen collection date or the illness onset date, then you can see that majority of those were reported in July, with lesser numbers reported in August, September, and October. But combined, we had about the same number of cases looking at it by infectious date in October as we did in September. So that's pretty good news. So looking at the characteristics of our COVID cases, we still see per capita the largest or the highest increase in COVID transmission occurring in that 18 to 24 category. So 7,000 people per 100,000 people who are 18 to 24 have COVID-19. And then just looking at the raw numbers, that 25 to 49 age group is the highest, contributing the highest number of cases, representing about 38% of our cases countywide. So just want to mention a couple other things. So when we look at the 7 and 14-day trend, again, when we plot that, looking at that infectious date, that date that's closest to when we think the person was actually infectious, we're looking right now at 7 and 14-day moving average, around 50 cases per day. And again, the number of hospitalized on any given day in the low 80s. So we talk a little bit about the number of people visiting emergency departments for COVID-like illness and influenza-like illness. That is still quite low, less than 2%, and we will be closely monitoring that as we move into flu season. The number of deaths reported by week have creeped up just a little bit. We're doing much better with preventing death in hospitals these days with some of the treatment that we have available to us, remdesivir, convalescent plasma, those sorts of things. So, and we have, more ventilators available, all of those things to try to make sure that we take care of those that are most vulnerable to severe complications and death. But the deaths that we do see continue to be in the age category of 50 or older, with the overwhelming majority, more than 75%, 65 or older. And then finally, from our weekly report, next to finally, sorry, we look at the percent positive rate. So these are the number of positive laboratory results divided by the number of all laboratory tests conducted. And when we look at our traditional surveillance systems, that's sitting around 6% still. But we know that the percent positive is much higher in the facilities around the county that are conducted rapid tests. So these rapid point of care tests that can be performed in, 15, 20 minutes sometimes. People who are most likely to have COVID, so they have a really high pretest likelihood. Perhaps they know they were exposed. Perhaps they have symptoms of COVID. They're seeking out those rapid tests. And in those locations that are doing rapid tests and sharing that information with us, they're seeing around 18 to 19 to 20% positive, which is really alarming. But when we mix in those rapid tests along with all those PCR tests that are more likely to be conducted on asymptomatic people, the percent positive is around 6%. So lastly, just want to say the 2 zip codes that we have accelerated transmission, much more community transmission than anywhere in the county, are 36571, that's a Saraland zip code, and 36572, that's a Satsuma zip code. So in those zip codes, we know that we have outbreaks in the school system there, and we've been consulting with the folks and the administrators and leaders of those schools, trying to help them think about ways that they can slow transmission. And we just really need the help of the community, the help of parents, the help of students to try to isolate for 10 days if you have COVID and stay at home for 14 days if you have been exposed. It's very simple. There's no testing out of quarantine yet. That may be coming down the line. We have no idea. But right now, it's 10 days at home if you have COVID and 14 days at home if you're exposed. It's really, really important that everyone do their part to try to slow the spread in those school systems and in those communities to try to protect the most vulnerable population. So countywide, we have something like nearly 40 schools that have reported at least one case of COVID to us. About 15 of those, I think, have outbreaks. Dr. Shavers will correct me when he gets up here in a minute if I'm wrong. But again, we're just seeing COVID, in those younger populations that are going to do well with COVID, but they are the ones that potentially are going to spread COVID to their loved ones inadvertently. Don't even know that they're shedding virus. And we want to make sure we are asking for parents and grandparents and school-age kids to please adhere to the isolation and quarantine orders. There is a new dashboard, a new school dashboard. Scott might have talked about this on Friday, where you can look at the number of cases reported weekly by school system. Satsuma, Chickasaw, and Saraland are there. You can look at the number of cases that they've reported in the last week. Mobile County School System is reported in aggregate for Mobile County schools. So that's not entirely helpful. Last week on the dashboard, they're showing that they had 12 COVID cases in students, but the Mobile County Public School System does have on a public-facing website the number of COVID cases by school. So if you want to see the details, you can get that available to you. just again, a little bit more context about outbreaks. We have COVID outbreaks in 7 long-term care facilities around the county. We are working very closely with those folks. They're in much better shape now than they were in April and May because we have point-of-care testing, test results come back quickly. We have more PPE now than we ever had, so long-term care facilities are able to adapt and be more nimble about managing those introductions of COVID once it occurs. And then I think that was the last thing maybe I was going to say. Again, a reporter asked us about the high numbers in Saraland and Satsuma, and we do believe that that's being driven by transmission in those younger age groups, and we are seeing outbreaks in schools there. So stay tuned. And then I will mask up and let Dr. Chavers speak with you about vaccine and the current state of politics, I think. Okay, come on, Scott.
Hello, everyone. I'm Scott Chavers. I'm head of COVID response here at Mobile County Health Department. A couple things. One, I would never correct Rindy. And two, I will stay out of politics. But we did have a couple of questions from the media with projected President Biden's task force being announced today, as well as the publication of his 7-point plan and possibly what that would mean to us. And I won't go into this in detail. You can look at the 7-point plan. Essentially what presumed President-elect Biden's plan covers is 1, increasing testing and contact tracing, 2, expanding vaccine coverage and vaccine availability, 3, focusing on high-risk groups, particularly the elderly and those that are being disproportionately affected by the COVID outbreak. And then national masking and also basically ramping up our supply of PPE, as well as putting in place a response for any new epidemics and plugging back in globally. So we've seen these before. These are not new in terms of strategies. I guess what I would say is that the devil is in the details, and how that will affect us locally is yet to be seen. I think what is particularly interesting is taking a look at the focus on increased testing and contact tracing. Those are ingrained in public health. We know those work. We have had issues with keeping up with the volume of COVID. So certainly that would help us here at a local level. PPEs and being ready for the next epidemic. So what we've learned from COVID is there's always that possibility, and many of us for many years have thought, that the other shoe is going to drop and we're going to see these pandemics occur, and COVID-19 is certainly one of those. I think the most politicized aspect of any of these plans have been the universal masking. We've been under a mask order from Governor Ivey since, I believe, back in April. And so, hopefully we move away from the politics around masking. We know masks work. We know that if you use them correctly, you wash your hands prior to putting them on and taking them off, and you socially distance. That's one of the aspects that really do prevent the spread of the SARS-CoV-2 virus. From there, I'd like to transition into discussing the Pfizer vaccine announcement. So if you've missed the headlines, Pfizer released the results of what is called an interim analysis of their data. And the interim analysis was based on the number of individuals that were infected in the clinical trial. So they had set a benchmark, and they reached that benchmark. By the time they did the analysis, they had reached 92 individuals that were infected across both the treatment and the placebo arms of the vaccine trials. So in looking at that, their data safety monitoring committee evaluated that and estimated about a 90% efficacy for the actual vaccine, which is outstanding. You usually do not see a 90% efficacy rate for any vaccine. In fact, the only one that I'm familiar with, apart from the Pfizer vaccine, is the measles vaccine that has that level of efficacy, which is extremely high. The other aspects, though, for us to keep in mind is that Pfizer does have very good production of, capability, but the vaccines are not going to be available all at one time. The vaccine data still has to be submitted to APIC, and then it has to go to FDA for approval. All this will be sped up under Operation Warp Speed, but we're still looking at probably third week in November before they finish their follow-up for safety, and then they have to go through the process. So in reality, before we see the vaccines, you're probably going to be looking at the end of the year for the Pfizer vaccine. What's important there as well is that manufacturing capability and the number of individuals that could be vaccinated and potentially reach the state of being immunized. So the Pfizer vaccine is a 2-dose vaccine. So after the first dose, you wait 21 days, you come in and you get your second dose. It was after the second dose that they were seeing the 90% efficacy rate after 7 days from that second. So then we get into questions around herd immunity. So what herd immunity is, it's a concept that you'll hear quite a bit about the number of people that are immune to infection that have to be immune for those that are not immune to be protected. So I do caution everyone when we talk about herd immunity because this is not something that epidemiologists evaluate in real time. We always have to do that in retrospect after an intervention is put in place like a vaccination and look at all the caveats around how that works. So there's a couple things to keep in mind here around achieving complete vaccine coverage. So if we take a herd immunity target of 70% and then you look at a 90% efficacy rate over 2 vaccines, that means that you roughly have to vaccinate 77 or 78% of the population. The other things you have to keep in mind is there are going to be people who cannot be vaccinated. Additionally, there'll be individuals that come in, they'll get the first vaccination, they will not come back for the second vaccination. So the level of immunity that is imparted with only one vaccination is still to be determined. The other issue that we don't know yet, and it's a big unanswered question, is how long does that immunity last? So if we're looking at COVID being a constant or an endemic within the population, how that vaccine actually protects individuals over time plays a lot into herd immunity. With the limited vaccine availability as well comes the question of, well, who will get the vaccine first? There's several different scenarios in terms of rolling out the vaccine, but what most of the scenarios agree on is that first responders and healthcare providers will be in the first round of vaccines. Then the second round will look at congregate settings and in particular long-term care facilities. This again is a herd immunity question wherein you don't want to leave anybody unvaccinated when the risk of severe outcomes is so high. From that level, then you start going out into other spheres that will include the general population, but before that, typically individuals that are at high risk and having underlying conditions. So high risk being of older age, certain demographic areas that have higher rates of some of these comorbid conditions that result in more deleterious outcomes. And then it will go into social supports, such as school teachers, and finally those individuals who are relatively healthy and tend not to have the more severe consequences. So that in itself, the rollout of the vaccine and who gets it first has been a discussion that's been ongoing. It's been occurring here locally at Alabama Department of Public Health and with CDC, and it will certainly be informed by Operation Warp Speed. So thank you very much. I believe that's all the questions we have. James, do we have any more? No, we're good. Okay, so thank you very much. We'll be back on Friday with our next COVID update. Thank you.